The nearly 10,000 square foot Sorrento Valley Clinic is designed to offer medical and mental health services to an estimated 17,000 veterans each year. VA officials say the new clinic will help reduce long wait times for patients seeking an appointment. Here with further details is my guest, Cindy Hebert, Associate Director of San Diego's Veterans Health Care System. And welcome, Cindy.
Thank you.
Now tell us a little more about this new clinic in Sorrento Valley. What kind of services are offered?
Yes, as you mentioned, it is a 10,000 square foot clinic and will offer primary care, mental health. We'll also have laboratory services there, pharmacy services, and women's health.
And you mentioned behavioral health as well.
That's correct, mental health services as well.
But no, just to be clear, no emergency room and no pharmacy on site.
That's correct. That's
okay.
correct.
Earlier this summer, the VA reported that wait times for new patients of up to 44 days to get to be seen. What is that like now?
Right now, we're averaging 5 days for all of our all of our established patients for primary care, specialty, and mental health. So that's an average. And for our newly enrolled veterans, we're averaging 20 days. So we have reduced that significantly since the first report.
Yeah, more than cut in half. What about the new clinic? How is that going to help ease the situation?
The new clinic is an opportunity for us to expand our capacity at this clinic. As you mentioned, we will have the ability to see approximately 7,200 additional patients. We'll have 6 primary care teams there. Each team is comprised of a provider, either a physician or a nurse practitioner, an RN, an LVN, and a medical support assistant. And each team will have the capacity to see about 1,200 patients. So it will help us to increase our overall capacity, timeliness, etc.
And is that because this sort of gridlock for the veterans, is that actually a space issue? Did San Diego outgrow their capacity to help veterans seek medical services?
Yes, that's part of the issue. Over the past probably 20 years or so, San Diego VA Medical Center has increased our workload about 5% a year, and we did outgrow our space. And this is one of several initiatives that we have had underway for some time to be able to accommodate our growing workload.
When can patients start making appointments, and when will they be seen?
Monday morning, the 25th, August 25th, clinic hours are 7:30 to 4, and we can begin seeing patients at that time. If veterans would like to contact us, our contact information is on our website.
And is there direct public transportation? Because that's sort of a North County, one might call it a North County area.
The closest public transportation would be the coaster stop there at Sorrento Valley. It is about a 3/4 of a mile distance from the coaster station to the clinic, but it's relatively close by. In the future, we may be offering shuttle services, but we have not implemented that at this time.
Well, I understand San Diego's VA health system will get some new federal funding. Can you tell me how much that's going to be and where it's going to be spent?
Sure. Nationally, the VA is receiving approximately $17 billion, and that's for a variety of things. For non-VA private health care, so that we can assist veterans in being seen more timely, sending them into the community if they choose. We, at this point, do not know the portion that San Diego will receive. We'll know that
of that $17 billion.
Of that $17 billion, San Diego will receive a portion, and we do not know at this point what our allotment will be.
Will there be plans, or I should ask, are there plans to expand and do these clinics in other areas to, again, relieve some of the pressure here?
The legislation that was recently passed did allow for 2 clinics that impact San Diego, the replacement of our Mission Valley Clinic. Right now, we're in a 50,000 square foot space where we're co-located with the Veterans Benefits Administration. So the plan would be to move that clinic to a separate building, a separate location at approximately 165,000 square feet. We're at 50,000 square feet now. So legislation did approve that at $11.9 million. And the second clinic would be Chula Vista. Right now we're in a clinic of about 10,000 square feet, and it will allow us to expand to a 30,000 square foot clinic somewhere in the Chula Vista area.
All right. Well, we'll be keeping our eye on that. And Veterans Healthcare System, Cindy Hebert, thank you so much.
Thank you so much.